All right, let's dive into a really cool system designed to answer a question that, you've probably asked yourself a bunch of times. Is it actually a good idea to exercise outside today? The answer is way more complex than you might think, and this Health and Sustainability Navigator, it uses a whole team of AI agents to figure it out by connecting your personal health to the world right outside your door.
I mean, we've all been there, right? You've got a little bit of a cough, but you're determined to get that run in. So you find yourself asking, is it really safe to go jogging? It feels like a simple yes or no, but the answer depends on so much more than just how you're feeling in that moment.
And that's the thing. So many of our day-to-day health decisions are missing that crucial local context. That mild cough, it can get a whole lot worse if the air quality outside is terrible. That workout may be totally fine at 6 in the morning, but genuinely risky by 2 p.m. if a heat wave suddenly rolls in.
So this gets us to the real heart of the problem, what we're calling health's missing link. We're going to break down why having all this data scattered all over the place can actually lead us to make some pretty risky choices, maybe without even realizing it.
And what's wild is that all of this information, it's already out there. You can look up your symptoms, you can check the weather, you can find air quality maps. But here's the kicker, none of these data points are connected. You're left trying to be the detective, piecing it all together yourself, and you almost never have the full picture.
So, okay, how do we actually bridge that gap? Well, that's where the solution comes in, the Health and Sustainability Navigator, a project built specifically to connect all those dots for you. At its core, the Navigator is basically a smart system that acts like your own personal health strategist. It takes what you tell it, your symptoms, and then it goes and pulls in real-time local data, things like weather and air quality. Then it cross-references all that with public health evidence and boils it all down into one simple, actionable plan. And for anyone who loves the nuts and bolts, it's designed with some really powerful features. It can run right on your own machine, which is huge for privacy. It plugs directly into Kaggle, which is great for data scientists who want to experiment. And, this is critical, it supports sessions and memory, so it actually remembers the context of your conversation, and it gives you full observability. That means you can see exactly how it's making its decisions every single step of the way.
But how does it actually do all this stuff? Well, it's not just one big program. It's more like a coordinated team. So let's meet the agents and see how this whole multi-agent system really gets the job done.
The whole process works kind of like a specialized assembly line. It all kicks off with an intake agent that figures out what you're asking. Then, 2 agents jump in and work at the same time. One is grabbing medical knowledge, and the other is pulling down real-time local data. From there, other agents step in to assess the risk, translate all those environmental factors into actual advice, before a final planner agent assembles everything into one clear, easy-to-follow plan.
Okay, so that's the theory. Super cool. But how can you actually get your hands on it and use it? Let's get practical and walk through the 3 main ways you can run the Navigator for yourself.
So the most direct way is right from your command line. You just run a simple Python script, and boom, the whole system kicks into gear. And what's cool is that behind the scenes, it's saving all the data from your session and even logging performance metrics so you can see just how fast everything is working. Now for all the developers out there, there's a FastAPI endpoint. What this means is you can basically integrate the Navigator's brain into your own applications with a standard API call. You just send it your query, and you get back the full structured plan. It makes it incredibly versatile.
And for the data science crowd, there's a Kaggle notebook. This lets you run the entire system inside Kaggle's online environment, which is a super popular platform for data projects. It's a fantastic way to just get your hands dirty, play with the architecture, and see the agents interacting firsthand.
Now, the system works great right out of the box, but you can also level it up. If you add an optional API key for a service like Gemini, you unlock more advanced AI-driven guidance. And with an OpenAQ key, you get access to this massive network of real-time air quality sensors for even more accurate data.
This is all really amazing for personal health, for sure, but I want to zoom out for a second. Let's talk about the bigger picture here, because this project is really a blueprint for good, with an impact that goes way beyond just this one use case.
When you boil it all down, what this thing enables is a fundamental shift. You go from having scattered information and making these high-risk guesses to having a unified plan that empowers you to make safer, proactive choices about your health and your environment. It's a total game changer.
And that right there brings us to the most important takeaway. The Navigator isn't just a one-off tool for health advice. Its real power is that it's a reusable blueprint, an architecture, a recipe that you can apply to almost any complex problem out there.
I mean, just think about it for a second.
you could apply this exact same multi-agent model to so many other fields. Imagine personalized education plans, or managing complex patient cases in healthcare, or citywide sustainability planning, or even coordinating community safety responses. The possibilities are just huge.
Which really leaves us with one last big thought. If a team of specialized AI agents can solve this complex problem of environment-aware health, what other tangled, messy, data-heavy decisions in our lives could a system like this help us finally unravel? That's really something to think about.